Thank you, Lonnie, but this is not about introducing me. This is about introducing Tim Smeeding and this report. I was talking with Tim about a week ago, and I think I first met Tim Smeeding in the fall of 1984 in a conference at Williamsburg sponsored by IRP that resulted in the volume Fighting Poverty, which now is an ancient volume, but a few of you here might still remember that. You know, you can't be in the poverty field without knowing Tim Smeeding. He is the Lee Rainwater Distinguished Professor of Public Affairs and Economics. He was, as Lonnie noted, the IRP Director from 2008 to 2014. He is also the J.K. Galbraith Fellow of the American Academy of Political and Social Science, and I could keep going with a list of fellows. I'm not going to begin to list his books and articles. The main thing to say is he is one of the most respected scholars in the field of poverty, not just for what he's done, but for the entrepreneurship that he has brought to this field in terms of being creative, coming up with new ideas, new ways to put data together, very involved in really doing a whole bunch of exciting data in Europe in the 80s and the 90s, and has continued that. If you want creative ideas and thinking outside the box, Tim is always a good person to talk to. This National Academy report, I'm quite excited about, and I'll be interested in your reaction to it. It is a very thorough review of the evidence and the policy effectiveness of various anti-poverty initiatives aimed at children. There are a lot of ways to measure the greatness of a nation. And I'm an economist. We always talk about GDP numbers and growth numbers and that sort of thing. But I'm not the first one to say, and I strongly believe that one of the most important measures of a country is how it treats its children. And this report is absolutely central to that particular measure. And there is both hope in this report, things we can do that will indeed make a difference, and a call to action. And the real question is whether anyone will heed that call. So I turn it over to Tim. Thank you.
Hi, everybody. Thanks so much, Becky. I really appreciate it. Your leadership has shown us a lot. You actually got a poverty measure out there that shows what happens when we look at the programs that make a difference, and we're going to look at those today. I also would like to just for a moment thank my mentor, Bob Haveman, who in 1970s pushed me to write my dissertation on the anti-poverty effectiveness of in-kind transfers. The first time anybody said, how do these things affect poverty? And, well, the theme's been with me for a long time. And Bobby Wolf was a reviewer of the report, too. So a lot of people and others have been involved, too. Hilary Hoynes, who is Amy Williamson's sister, was one of the principal people I work with, and you'll see a whole bunch more in a minute. Before I get started, though, this is a roadmap, okay? This is sort of macro social policy at 10,000 feet. This is not to replace anything that you guys do on the ground here every day to provide food, housing, clothing, shelter. The people who work with WISCAP, the people who work with Wisconsin Council of Churches, the people who work with Kids Forward, people who work with United Way, and everybody else. The whole idea of this is to make your job a little easier, to have a little more of a cushion, to have something behind, in terms of support, behind people who really need it, and especially for kids. So that's where we're going. So hopefully if this happens, we'll have a much better environment. So this is the roadmap. There you go. It's a roadmap. Okay. We got a lot of sponsors. You can always tell I was telling Becky we raised a bunch of money. And all of a sudden the whole National Academy is there to work for you because everyone wanted to sponsor this report, which was great. Department of Health and Human Services, under Obama, actually wrote the statement of task, the Obama administration, and gave some money from Congress through HHS to run it. And then these other people, good friends of ours, they got in too. Here's the staff. There's a wonderful staff, really, really nice people who helped us, including Connie Citro, who wrote, thanks Lonnie, who actually wrote the new poverty roadmap, the way we think about it in 1996 with Bob Michael and with Tony Atkinson, one of my mentors and friends and others. We got a whole bunch of people together. All of those animals were in the zoo. In particular, Greg Duncan, was the head of the committee, very able member of the National Academy. Larry Aber, developmental psychologist. Dolores Acevedo Garcia, developmental psychologist from Brandeis. Janet Curry, Bernard Dreyer, who is a physician and the head of the anti-poverty task force at the American Pediatrics Association. Irv Garfinkel, who was a former director here. Ron Haskins, Hillary Hoynes, I mentioned, Chris Brown, Vonnie McLeod, Robert Moffat, who's run our summer workshop for 20 years here. Cynthia Osborne, who was here earlier this year and gave some talks, who is a demographer but a really hands-on-the-ground person. Eldar Shafir, who's a developmental psychologist who writes about stress, and me, and Don Winstead, who actually tells people how to run programs. So it was an amazing group of people. I mean, just absolutely amazing group of people. So the problem that we have is that child poverty is not good for kids, okay? It compromises the health, learning, and development of our children and their future employment. And we're talking about 13% of children, 9.6 million in 2015, with incomes below the poverty line, and nearly 3% in deep poverty, that's incomes below half the poverty line. Now, you will find out later, we've adjusted all these numbers for underreporting and done the best we could to represent the actual impacts of the programs. And you also find that poverty is very high among people of color, highest among Hispanic children, but also blacks, American Indian, Native Alaskan children, okay? This is the problem. Child poverty, if you start with child poverty and you go through the stress pathway and end up here, you end up at an annual cost of somewhere between $800 million and $1.1 billion a year. We have poor child health, lots of adverse childhood experiences, worse adult outcomes in terms of educational attainment, lower earnings, incarceration, so on and so forth. So the cost is huge. The cost is huge. And the cost can be avoided. That's the interesting thing. Here, for instance, is something that Greg put in, so I'll put it in with Greg. It's about total gray matter. If you followed Seth Pollack and Bobby Wolf's work and the work of Kim Noble with Catherine Magnuson and others, you know that kids' brains begin to change early on, and poor kids end up here, and rich kids there. Those brains look different, they behave differently, and kids learn different things. So being born into poverty makes it really hard just from the beginning, just from the beginning. Okay. So every study is done according to what we call a SOT, statement of task. This is what you're supposed to do. Do this. And so this is our statement of task, okay? We have to review the research and linkages between child poverty and child well-being, not just poverty and well-being, but also what happens if you alleviate poverty, how does that affect kids? Provide objective analysis of the poverty-reducing effects of the major assistance programs that we have, and then provide policy and program recommendations for reducing the number of children living in poverty and deep poverty by half within 10 years. Within 10 years meant that we've actually downplayed the long-term developmental effects of helping young kids, the things that pay off in the long term. We believe that there should be a companion panel that looks at those things. So this is mainly about helping kids in a quicker time period. Okay? Now here's our baseline, and by race. You remember that 13% up here, 2.9% here. You can see that Hispanics have the highest poverty rates, then blacks, and then white non-Hispanics last, okay? It's very interesting that when we looked at this, one of the things we found, and wait till I get to the composition, and I'll mention that. Less educated people have much higher poverty rates, much higher deep poverty rates, and we even looked at near poverty rates, and it's incredibly high. People with a high school degree and less, more than half of them are living within 100% of the SPM poverty line. That's below $40,000 a year. So that's how people who have only a high school education or have never graduated high school live. It's a cruel world for those people, despite how hard they try. This is the composition of the poor, okay? You can see that no biological parent, which is really important. The official poverty numbers forget about adopted kids and kids who are in a child welfare system. They don't even count them. The SPM does. And if you look, you find that an awful lot of kids without a biological parent who are moving from different households. This highlights the idea that child welfare is important, that supporting kids is important. Single parents are also up there. Two-parent families have lower poverty rates, which is good, especially if they're two biological parents. So that's just another quick view of the baseline. And then this is the composition of the poor. Okay? White non-Hispanic are 51% of the whole population, 31% the poor. They're less than 1 in 3. Hispanics, 19%, 41% of the deep poor. Okay? So these are the share of people who are in these various categories. When we look more carefully, we found that almost 20% of Latino kids are U.S. citizen kids living with at least one undocumented adult. These kids are full citizens. They're eligible for programs, but their parents are scared stiff right now, and this is creating lots of issues, so we highlighted that. Okay? A 50% reduction in child poverty is achievable, though. The UK cut its child poverty rate in half from 2001 to 2008, as Jane Walfogel and others have shown. Canadians in 2016 instituted a $400 per child per month child benefit, which, according to the Center on Budget and Policy Priorities, would have reduced our poverty rate here by almost 60% using our same measures. Okay? So it can be done. Now, it's not like we haven't done anything. So if you take the supplemental poverty rate and you anchor it back in around 1970, and you follow this analysis that Chris Weimer did for us at the Columbia Poverty Center, you find that we almost cut our rate in half from 1970 to where we are now. Okay? But we're not going to continue down any further unless we do something beyond what we've done. That's the message. Okay? Now, in the absence of current programs that provide income, food, housing, and medical care, child poverty rates would be much higher. So if you just took away, for instance, the federal earned income tax credit and the refundable child care tax credit, poverty for kids would be 6% higher. Okay? SNAP, 5% higher. So these are the two programs that don't get counted at all by the federal government, but which do the heavy lifting in our country to help keep kids from being poor. One that's sort of an in-kind negative income tax, a guarantee of food, which is under some attack now, and the other one that works through the tax system to help people support their kids. SSI, Social Security, there are a lot of other programs that make a difference, but those are the big ones. Now, we looked at 20 individual policy and program options and 4 policy and program packages. Okay, so we had to go out and look, what are we going to look at, what can we do? And we had criteria. What's the strength of the research and evaluation evidence that this actually makes a difference in poverty and makes a difference for poor kids? Okay? And I'm talking about the causal evidence. We have lots of causal evidence in here. There's tons of evidence that lack of money, severe lack of money for kids and their families really creates problems for those children when they grow up. And there's also evidence that if the Earned Income Tax Credit, SNAP, and lots of other income support programs have big positive effects on those kids too. So there's evidence both ways, causal evidence. Okay? So what's the magnitude of the reduction? That's our goal, reduce child poverty. What about within high-risk subgroups? We've looked at single parents and minorities and things like that. What is it going to cost us? That's another thing we looked at. And then the impacts on work, marriage, opportunity, and social inclusion. And I'll talk about those as we go along. Okay? So here's what we did. For each of these different ideas, we had 2 different single ways of fixing the program. So for the EITC, for instance, we could expand the ramp up. We doubled the ramp up to 40% and left the phase out the way it was. In another expanded EITC, we did both. We expanded the EITC and the phase out. You could expand child care subsidies, which we think is incredibly important. So we made the child care tax credit fully refundable, as Jim Ziliak and others have recommended, and there's another child care package. We raised the federal minimum wage only to $10 an hour, okay? Or the 10th percentile of the wage distribution, which is something that's long overdue. It's long overdue in the state too, by the way, okay? I am not a $15 an hour minimum wage person, I want you to know. That's going to cause more problem. We can argue about that later. But we need to get to $10 or $11 in this state and soon. We implemented a promising training and employment program called Work Advance from MDRC. It's their most powerful work and training program. So we said, what if we give people work supports and we train them? How will that do to reduce poverty? Okay. We modified existing provisions related to immigrants in a couple of ways to increase their access to safety net programs. They've been excluded from a lot of things. We took existing programs and we said, let's beef up SNAP. Let's bring SNAP back to where it was during the Recovery Relief Act. Let's expand by half the Housing Choice Voucher Program, or up to 70% of people. Let's expand SSI. Those are existing programs. And then we looked at 2 new programs that are used in all of the other countries to which we're being compared. We were told in our statement of task to compare ourselves to the other Anglo-Saxon countries, to Australia, Canada, the the UK, Ireland, and then us. So that is who we compare ourselves to. And that's replacing our child tax credit with a universal child allowance. It's essentially taking the child tax credit and paying it, going to someone like Social Security and paying it monthly per child as a debit to every parent in the country up to some cutoff income level, okay? And then a child support assurance program. In 17 different countries, if an absent father can't pay or won't pay, and they're making some effort, it's not the mother and the child's fault, so they top it up to a certain level, a very modest level, to be quite honest. This is actually a proposal that was made in a Russell Sage volume by Dan Meyer and Maria Kanchian, and Irv Garfinkel just slapped it in there. It's not very expensive, but it's pretty effective. So those are our batch. Okay? What we found is nothing met the 50% goal. Nothing by itself got us to 50%. Child allowance 2, which is $3,000 a year child allowance, $250 a month, which has actually been proposed by Senators Bennett and Brown now. They have legislation they introduced last week and I know that Senator Baldwin is a co-sponsor of that, and probably Mr. Pocan too. That was introduced by them to take the current child tax credit and move it to $3,000, make it fully refundable and pay it monthly. Okay? I'm glad to see that they paid attention to our report. And child allowance 1 just takes the current $2,000 per child tax credit and makes that fully refundable. Those have big effects. Well, housing vouchers, if you went to 70% of people, they would have a good effect, but housing vouchers are good, but there's always issues with where can you use the voucher. There's issues with local authorities. Local authorities decide what to do, and 60% of the public housing vouchers in this country go to elderly and disabled people, which probably they should. So it's not clear this would all get through to families with children. But we looked at housing vouchers. The immigrant stuff, the child support stuff, like I said, was small. The ITC can have an effect, and the child care can have an effect. Now, the interesting things about these is not just how they affect poverty, but you're going to see they also have a big effect on work effort. Okay? So, some program and policy packages did not meet the goal. So if we expanded the ITC and expanded child care tax credit, we call those work supports. In every policy package, we expanded work supports, in every one, because we think work is important. We think people should want to go out and work, that if we give them better child care and less expensive child care and a bigger reward for low wages, that they will go out and work. And they already are out working. So that's it. We increased the minimum wage slightly, and then we rolled out Work Advance. We doubled the size of the program. But in the end, it produced a lot more workers. It didn't cost a lot, but it by itself did not reduce poverty. Okay? Enough. It only brought it less than 20%. It didn't get us. It didn't get to 18.8%. It did not get us to the 50% goal. We have a second package. Now, this is a package that I personally kind of like, but that's me. We like all the packages equally, but this one. So what we did is we expanded the ITC and the child care tax credit, the same things. We need work support. But then we need income support. So what we began a child allowance here by taking the current level of the child tax credit and making it fully refundable to the 33% of kids who don't get it, kids in families with incomes below $15,000, and paid it monthly. Okay? There, we only get a little more than a third poverty reduction, but we get 568 million more people working and increases in work and self-sufficiency, and it costs $44.5 billion, which personally I think is a pretty good deal. Me. All right, so here come the two that got us where we want to go. One was a means-tested package where we, again, you can see in all of these, we expanded the child care tax credit, expanded the ITC. These are what we call work supports. People want those. Child care, survey after survey says, even fertility surveys say, we're not having kids or we can't go to work because we can't find good child care. So that's really important. And the earned income tax credit, everyone loves that. Let's make sure that it does even a better job than it has been doing. So that's in everything. Then the minimum wage was in the last package, but then this is a package that Robert Moffett and Hillary pretty much put together with Ron Haskins. They expanded the housing voucher program and they expanded the SNAP benefit. And if you put those together, you got the 50.7% reduction, okay? 51.7% in deep poverty, 400,000 more working, costs $90 billion. Remember, the overall cost is $880 billion. So it's not a cheap package. Now here's the universal work supports package, which includes the minimum wage, begins a child allowance, but the child allowance has to be $2,700 a year to get you to the 50% reduction. And the extra cost is that if it's $2,700 a year, every kid gets $700, not just the poor kids. So that's what's driving the cost up. If we raise the child tax credit to even where Rubio and Lee wanted at $2,500 a kid, and then just extended it down, that's relatively inexpensive. We began child support assurance, and we did everything we could to involve immigrant families and make sure that they get benefits. That got us more than enough. 2,400 child allowance almost got us there, not quite, so we had to go to 2,700. And we got 614,000 more jobs, but that costs $108 billion. And again, the big chunk of it is the fact that the child allowance itself, above the $2,000, extending it to everybody, $700 a kid, that costs money. Okay? So those were our packages. The lessons were that individual policy and program packages don't do it, but if you bundle work-oriented and income support programs, you can reduce poverty and increase employment, both at the same time, which is what we all aspire to and believe in. Now, we looked at other programs, and we were very definitive about what we thought about them. Long-acting reversible contraceptives are important. They can reduce the incidence of unplanned births, which could in turn reduce child poverty, but we weren't confident in the estimate of by how much they would reduce child poverty. You have to trace it out through a number of steps. Bell Sawhill took a shot. In the end, we had a vote. We decided not to put the number there. Okay? Mandatory work policies, like the one we're going to be doing with SNAP here in October this year. Evidence is insufficient to identify policies that would reliably reduce child poverty. We think, and we say explicitly in the report, we think that mandatory workfare is liable to do more harm than good. There's no evidence that it is going to actually help reduce poverty. Now, if you have enough good work supports, if you've got child care, if you've got health care, you've got transportation assistance, if you're willing to make allowances that people can't work 30 hours a week every week, that some people work nights and days, it might help. But you need all of those supports anyway. So why not have all those supports and then see if people actually just work more on their own? So that's what we're doing. Another thing that we can see clearly that married families and families with two biological parents have lower poverty rates. But the idea that you can promote marriage, there is no good evidence to that. We've tried it. There's some new evidence actually about relationship programs that OPRI just collected that's not in the report that says maybe a little bit here and there, but there's actually not much effect. It would be nice if more people would get married, but you can't just do it. So those are the other things. Now these were really important pieces in the end. These are contextual factors. These are really important things. This is the context within which we're delivering these programs, and the context is important, very important. Stability and predictability of income is incredibly important. Elder Shafir in his work, the work of the Financial Diaries and others, shows that low-income parents would actually trade some income and wages for more stability. To know that something comes every month, so you think the child allowance is there. Once you're eligible, it's there every month, okay? That's important. Equitable and ready access to programs. You can make program access harder or easier. We know that. You can see it in all sorts of programs. I can recommend Pam Hurd and Don Moynihan's new book, what? Administrative burden, about red tape and making it harder or easier. That is also important. Equitable treatment across racial and ethnic groups. Time and again, you find that minorities are denied benefits that others aren't denied, and they're treated differently. So that was important to us too. Equitable treatment by the criminal justice system is important, and as we're starting to make a little headway there. Neighborhood conditions make a huge difference. Growing up with other middle-class kids really helps, so we're very pro-integration. And access to health and health care improves child well-being and so forth. So all these things surround it, and they put some tinges on the program. So the next thing we're going to be doing is establishing a coordinating mechanism to ensure that the report is followed up on, and that decisions are made on priorities for new and improved programs and policies. And then, in fact, we continue to build the evidence base that we evaluate programs and policies. We see how well they work. You might remember that in this lovely state of ours, the former governor vetoed any evaluation of the food stamp employment program that goes into effect this fall. And I'm hoping that Mr. Evers or somebody can convince Congress that if we're going to force low-income mothers to work 30 hours, even if they've got kids of school age, let's go find out what difference that makes. That's just a fair thing that should be done. The mechanism should be also ensure that the associated research and data needed for monitoring, evaluating, and further improvements are supported as well. So that's essentially what we did. The bottom line is it's an attainable goal, but as Becky said, where there's a will, there's a way. There was a will in Canada, there's a will in Britain. We need to develop the will here. And I'm hoping that we might get there. There are a lot of proposals, progressive proposals from the left, some of which are, in my opinion, over the top, but a lot of them can make a lot of difference. Okay? So those people are there. This will be put on the Poverty Institute website, by the way. This is available. This is a similar presentation was made in Washington the day the report was released. So I'm happy to answer your questions. Feel free to ask them, and thank you for your attention.